Welcome to State of Affairs. I'm Steve Adubato, coming to you from the Agnes Veris NJTV studio in Newark, New Jersey. It is our honor to welcome Carole Johnson, Commissioner, New Jersey Department of Human Services. Good to see you, Commissioner.
Great to see you. Thanks for having me.
It's our pleasure. You are a member of the Governor Murphy cabinet. To describe the Department of Human Services, what do you deal with?
So I like to think of the Department of Human Services as the agency that helps New Jersey families thrive. So we're about ensuring that people have access to affordable health insurance coverage through Medicaid and the Children's Health Insurance Program, providing the services and supports people with intellectual and developmental disabilities need to live to their fullest potential, helping older residents in New Jersey live in their communities as long as they would like to. And we also are the social safety net for people who need a hand up. So we do the food assistance programs and emergency assistance programs, cash assistance programs to help people when they need that hand up. We also support people with who are deaf and hard of hearing and those who are visually impaired and blind with services across the lifespan, as well as other disability services to people.
A massive portfolio.
It's a large portfolio.
Autism spectrum on there as well?
Autism spectrum we serve through our Medicaid program. We are actually, as part of the governor's budget, proposing expanding the benefits for children with autism as part of the governor's budget.
The other piece that I find fascinating is the opioid epidemic. How is that an issue that falls into Human Services?
Because of the Medicaid program, we have the opportunity to expand services through a waiver we have with the federal government. And so we are now working aggressively to implement that waiver so that we can expand, so we can create a more complete Medicaid package of services for people who have opioid use disorder, including things like peer support services and case management services and the detox, and for those people who need it, inpatient services that will help people combat this epidemic.
Commissioner, what is Homefront New Jersey, Homefront NJ?
Homefront NJ is the facility where the governor hosted our swearing-in ceremony.
Yeah, but what's the connection?
Well, that is a place that does a full complement of services for people who are who need a hand up, and so it provides shelter services, it provides childcare services, and it provides that full complement of services. And many of those are the types of things that our department supports.
You know, you mentioned childcare, and I told you before we got on the air that we're involved in a public awareness initiative called Right from the Start NJ, Right from the Start NJ, dealing with infants and toddlers and prenatal care and what they need in the state and child care reimbursement. Does that fall into your area as well?
We are also the department that runs the child care subsidy program.
Explain what that means, the child care subsidy program.
Right. So first I should say that the governor's budget is really about focusing on how to make New Jersey a stronger and fairer New Jersey, and that includes focusing on affordable child care for families. And so the governor's budget proposes a new child care tax credit, which will help a number of thousands of families in the state be able to get that peace of mind from affordable child care. But there are other families in the state who are lower income who depend on our child care subsidy program. And that is a state benefit that's available to people who need support in being able to afford child care. And from my perspective, economic development and getting people to work requires making sure that we have a child care program that works for them, because you need that peace of mind, you need that security in order to succeed in your job. And so that's part of what we're working on as well.
You know, Commissioner, you have some experience in a previous administration in Washington, D.C., the Obama administration.
That's right.
Directly involved in the implementation, if you can say it that way, of the Affordable Care Act, otherwise known as Obamacare. Describe your experience and what you learned from it.
So for about 5.5 years, I worked in the Obama White House implementing the Affordable Care Act and doing a host of other things, including working on public health issues like Ebola and Zika and the like. What I was able to do, what I'm most proud of with respect to implementing the Affordable Care Act is that we were able to get tens of millions of Americans access to affordable health insurance coverage. And what that does is expands access to women's health care coverage. It expanded access. We made mental health and substance use disorder a required health insurance benefit in individual health insurance plans. So as we talk about the opioid epidemic, one of the things that we were able to do was to say that those benefits need to be part of the insurance package. We also focused on preventative medicine to make it so that you didn't have to wait to be sick to be able to get the services you need, and eliminating pre-existing conditions, which has made so much of a difference for so many families.
When you're here in New Jersey and you see the implementation or the efforts to implement, and some say to block with the new administration, well, not so new, the Trump administration, your thoughts on that? Or do you say totally away from that because that's a political public policy issue?
So let me say that I was so honored and humbled that the governor offered me this position, and it was such
By the way, excuse me before you go any further, you are a Jersey girl. You're from North Cape May, New Jersey.
That's correct.
Just want to clarify.
I grew up in North Cape May, New Jersey, so I'm coming home to New Jersey for this role. And I was so honored that the governor gave me the opportunity to do this, to be able to be here in New Jersey in what I completely agree with the governor is a new day in New Jersey. There's new opportunities and new chances to continue to advance our agenda. The last year in Washington has been difficult. If you were a person like me who spent 5.5 years working in the Obama White House, the last year as the Trump administration and Republicans in Congress tried to undo the Affordable Care Act, there was a lot of work that my colleagues and I did to try to push back against that. At the end of the day, the Affordable Care Act remains the law of the land, despite the fact that they tried to undo the Medicaid expansion and frankly, undo the underlying traditional Medicaid program.
Why would they do that? How does that benefit people who are struggling to get health insurance?
These are exactly the questions that we ask.
But they argue they're trying to make it better.
But at the end of the day, people need the coverage. So why would you try to take it away? It remains. The Medicaid remains the law of the land. The Affordable Care Act remains the law of the land. And frankly, it's never been more popular. So one of the things that we're focused on here in New Jersey is to make sure that people know that and that they sign up when open enrollment happens so that people get the coverage they need. One of the things we worry about is that all of this churn.
Go to healthcare.gov.
Go to healthcare.gov.
Go ahead. 15 seconds left. Go ahead.
All this churn and instability is not good for New Jersey families. We need to do right by New Jersey families, and that's what we need our partners in Washington doing too.
Carole Johnson is from North Cape May, New Jersey. She is the commissioner of the New Jersey Department of Human Services, previously worked in the President Obama administration. We thank you for joining us on State of Affairs. Don't let it be the last time.
Thank you.
Thank you, Commissioner. Wish you all the best.
Thank you.
State of Affairs from the NJTV studio, the Agnes Varys NJTV studio. We'll be right back right after this.
State of Affairs with Steve Adubato is a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. State of Affairs with Steve Adubato is brought to you from the Agnes Varys NJTV studio at 2 Gateway. Funding has been provided by the Turl Fund, the Nicholson Foundation, Valley National Bank, Horizon Blue Cross Blue Shield of New Jersey, Johnson & Johnson, United Airlines, Choose New Jersey, and by these public-spirited organizations, individuals, and associations committed to informing New Jersey citizens about the important issues facing the Garden State, and by Employers Association of New Jersey.